Hi, Dr. Saxena here, and I'm talking about something called intestinal health and how this is a very important thing, and correcting the problems of the intestine and adversely affect the intestinal membrane and beginning. It starts the healing process starts from there. That is a restoration. We call it as a restorative medicine, and see restoration of these tissues are of paramount importance in the health of those who has something like autoimmune diseases and all. So the primary function when we look at all autoimmune diseases, I try to start at the gut level. Gut is the intestines. Try to work with all the things, hyperfiltration and all that. I want you to understand what is this thing called digestive system is happening, what happens with the digestion. The primary function of the digestive system tract is to break down the large particles of the food that we consume into a small molecules that can easily cross over the intestinal barrier, that is the intestinal lining, enter the bloodstream, and from there it becomes fuel for the various metabolic processes. So what is happening at this level? In order to accomplish this function, the intestinal tract is involved in four primary functions. One is digestion, second one is absorption, third one is assimilation, and fourth one is the elimination. Each of these activities are described in a proper way. You need to understand what is digestion is defined as a process whereby food in the gastrointestinal tract is broken down chemically and mechanically into absorbable forms that can be utilized by the body. And digestion occurs primarily in the stomach and small intestines, and to a lesser extent in the mouth. The next phase is called absorption. What is this absorption? Absorption is defined as the process whereby nutrients from the digestive foods are crosses the gut wall and pass into the and into the bloodstream, and from where absorption mainly occurs from usually from small intestines, and but to a some small extent in the large intestine also, as well in the stomach. So this is the another essential part. The third one is called assimilation. Assimilation is described as a series of steps in which the products of digestion are utilized for energy and are chemically converted by the body's metabolic process into living tissue. Assimilation takes place at the cellular level. And the fourth one, which is also important, is called elimination. Elimination defined as the excretion from the body of the waste products produced during the process of digestion, absorption, and assimilation. Wastes are eliminated through the intestines, kidneys, skin, as well as from the lymphatic system. So you need to understand what are the properties of this digestive tract. Intestinal tract is I've been talking about, it's a quite complex and intricately configured organism, and the properties should you need to understand the properties of this intestinal tract. And when the disease is present here, there are a number of facts about its structures and functions. The actual working of the digestive system is of utmost importance, because 70% of your immune system is from your intestinal tracts. Immune system in humans is located within the intestinal tract and the digestive organs. 70%. Small intestines, it averages between 15 to 20 feet in length. The inner surface of the small intestines is composed of tiny folds and finger-like projections called villi and microvilli. The purpose of this is to provide the maximum possible absorption area. So that is the kind of surface area for the nutrients. And if the small intestine were to be unrolled, unwrinkled, and without a villi or microvilli and all that, its total surface area would be something like of a size of a big court, tennis court. So it has to be kind of crumpled and all that. That's the reason this is one particular thing. And this intestinal lining has the ability to repair and regenerate itself every 3 to 5 days. When the surface area is as large as the tennis court, it is actually in its actual thickness is no greater than the human eyelid. The thickness of that particular stuff. So when stretched out, the surface area of the colon is about half the size of a pool table, I can say. And in adults, and seen it is absorption of water happens at colon level. At any time, at any given time, there is something like about 1 trillion bacteria. I'm sorry, it is 100 trillion bacteria which inhabit the healthy human intestinal tract. And some of the bacteria rank the most toxic among the environment, and 1/3 of the stew is made up of this bacteria and their byproducts. So this particular what we are talking about, this intestinal health in this series, I must tell you the purpose of this thing is to identify what is damaged. When I try to work at a holistic level and we try to work in the integrated system, the first step is your intestinal tract, and we would like to start from mouth itself. The process of digestion occurs from mouth. Food which is thoroughly chewed by the teeth in order to maximize the surface area and thereby making the nutrients more available for absorption is one thing which has to be always considered, and this has to be taught to the people, particularly for the PH patients, because people if you are not chewing it properly, there is a enzyme in the saliva which is called tannin, and it helps in a big way trying to help. It's a pre-digested food goes into the stomach and makes them. If the person doesn't chew his food thoroughly, what happens is that, or when they eat too fast and swallow large chunks of food, there is a less of a surface area available for absorption, and this in turn places a greater burden on the stomach, and this person may suffer from resulting problems with indigestion, which it was as simple as heartburn, acid reflux, gas, and belching. These are the basic things which we are trying to make people understand. These are the basic tenets. If you are able to work on these tenets, we can always we believe that any kind of incurable disease, any kind of chronic disease which you are trying to fight out relentlessly for years can be worked out by this particular things. Fixing of the gut is the most important thing what I could understand because of my 20 years of work in this integrative medicine. So once the food enters the stomach, it continues to broken down by both mechanical and chemical processes. Mechanically, the stomach mixes the food and blends with the digestive secretions such as hydrochloric acid and the enzyme pepsin. The end result is a product called chyme, which is a soupy consistency similar to a liquid, something like oatmeal, something like that. So pepsin is a primary enzyme constituent of the gastric juices and is produced by the chief cells of gastric glands, the primary function of which is protein digestion, which it accomplishes by converting proteins into proteoses and peptones. It requires highly acidic environment with a pH of 1.5 to 2 in order to do its job. Another thing is of importance is the hydrochloric acid, which is secreted by the parietal cells lining the stomach, which is essential again for the protein digestion and facilitates the absorption of vitamins and minerals. HCl is extremely acidic, but the thick layer of mucus coating the inside of stomach prevents HCl from damaging the gastric lining. So that is the one thing which is always you need to work it out. If this mucus layer becomes compromised for any reason, The HCl can irritate and burn the stomach lining, resulting in the gastric ulcer. So the you need to this are some of the basic things. Stomach acid has number of very important functions. It begins the process of protein digestion by breaking down part the protein chain in the food. It acts as a sterilizing agent by killing the bacteria. Bacteria, yeast, viruses, and parasites that we ingest by the way of foods. HCl is the major kind of thing which is able to neutralize all these things. It also helps in breakdown of our food and make vitamins and minerals contained therein more available for absorption. And finally, the HCl signals the pancreas to secrete the enzymes, not just enzymes, something like bicarbonates and hormones that are essential for the next stage of digestive process, which takes place in the small intestine. So, having said about all HCl properties, when there is an insufficient amount of hydrochloric acid are present, some physicians believe to be there are big number of cases where insufficient HCl is made. It happens with the autism cases, it happens with some other cases as well. So there is a tendency, there may be a greater tendency of intestinal overgrowth and harmful bacteria, harmful microbes, so the bacteria, fungi, parasites and all that. And apart from that, the protein digestion is inadequate, and improper processing of vitamins and minerals can lead into generalized deficiencies of these minerals, can lead to this generalized deficiency is one thing which is seen very commonly these days. I'm not able to understand why this person has got so many vitamin deficiencies, character, in spite of his blood levels showing some good stuff. But when we see his vitamin B12 and we check it, and it looks quite okay, but at the end of the day, what his vitamin B12 shows on the paper and what his symptoms, they do not match. So these are the small nitty-gritty, all small things. So these are probably consequence of a insufficient hydrochloric acid, which has results in abnormally low secretions of pancreatic enzymes, which is very common these days, and which results in food maldigestion, food malabsorption, as well as allergies, food allergies, food sensitivities, and adverse reactions to gluten and casein peptides. These are the things which I somewhere see very clinically. What are the clinically signs? The moment I see someone having gas problem, bloated, belching after meals, vertical ridges in the fingernails, and feeling that food is sitting in the stomach for a long time after eating, these are the signs of inadequate HCl. Normally what happens is the food remains in the stomach for at least 4 hours, and depending on the food consumed and all that, and it has to go down into the intestines and all that. So while the process of absorption occurs principally in the small and large intestines, and there are a few things such as water, alcohol, it can include something like aspirin and all that, which are directly absorbed from the stomach into the bloodstream. So once the stomach has done its job and the food has been covered in chyme, it passes through the pyloric wall into the first portion of the small intestine, where the secretions of the pancreas play an important role. Alcohol and all that, this bypasses that particular stuff. Alcohol, water, or some things like aspirin also. So coming to this thing called pancreas, I can always talk about in a detail later, but I want you to understand what are the symptoms, the gas, the bloating, the people presenting with belching after meals, you have all these problems are probably a result of this inadequate hydrochloric acid, and this is one thing which can be easily corrected by working in an integrative medicine with these concepts, not by reducing the acid further, which is being already there are big number of now people tend to go to over-the-counter drugs to reduce the acidity. In fact, it is not the. In fact, this should be a other way around. It is a deficiency of HCl, hydrochloric acid, which is causing that. Thank you.